So now let's move on to late implant placement. And clearly, this would be the least desirable option for teeth in the maxillary anterior region, clearly because of the possibility of significant bone resorption. So if you had to take a tooth out and then recommend a time frame, say, to replace this central incisor, you would not recommend a late placement without intervening in some way because of that risk of advanced resorption. So these are cases where socket grafts for ridge preservation are strongly recommended. Right? If you need to delay this for any reason, then to minimize the resorption and to then maximize the potential for an implant to be placed with simultaneous augmentation as opposed to doing a staged grafting procedure, then I think we can do a great service for our patients if we recommend and if they accept a graft to be placed at the time the tooth is taken out. So socket grafting can also be considered when there is doubt whether your patient will commit to implant therapy. And this is a case, I've just taken out a lower molar and this patient was not sure whether she would have an implant. She thought maybe I can function without the lower molar. But I said, look, you know, if you might change your mind, and if you change your mind, at least if we place a graft into this socket, even if it's 2 years down the track, you can still have the opportunity to place the implant in a straightforward way. So if your patient has doubt, or if they have medical issues which they're concerned about, if they're planning to travel, if they have other commitments, if there are financial commitments, for example. So whenever there is a delay, and in younger patients, that's another great example of when we could adopt a socket grafting technique, then I think late placement that has been preceded by grafting of the socket is the preferred option, and particularly in the maxillary anterior region.